Welcome to PopHealth Week, streaming live on Healthcare Now Radio. I'm Gregg Masters, co-founder and executive producer. Joining me in the virtual studio is partner and co-founder Fred Goldstein, lead host and president at Accountable Health LLC. PopHealth Week is your destination for unfiltered conversations with the visionaries driving population health forward. Whether you're a payer, provider, patient vendor, or policymaker, this is your go-to hub for fresh strategies and insights into population health best practices. Want to stay connected? Visit popupstudio.productions or message me on Twitter via @GreggMastersMPH, and that's Greg with 2 G's. And do follow the show at PopHealthWeek. To reach Fred direct, visit www.accountablehealthllc.com. With no further delay, Fred, who's in the seat today?
Today, it's actually me, Greg. And the reason is I'm kind of seeing all this stuff come out, these cuts going on, what's happened at ADA with their meeting, the impact of social media. And I finally said to myself, enough is enough. And then ended up publishing this piece on my website and on LinkedIn.
And, I saw that on LinkedIn and I read through it, and it was like, okay, well, this is slightly a bit out of context. What's he really getting at here? And I drilled into, I got it. So this is an important subject. I'm glad you're available to do this today, Fred. We've had, in the past, we've drawn attention to some of the, shall we say, failures in leadership that seem to be a part of this administration. But the main thing, and we'll get to this, is the enough is enough. It's about the decimation of essentially public health infrastructure. And public health infrastructure is like a Rorschach test. You can kind of project onto that what it means to you. In general, public health infrastructure is about health departments, historically, chronically underfunded health departments. For clinicians to sort of traffic into that career path, they had to be heart-centered and mission-driven, because the money ain't there. I can assure you, the money is not there in public health. However, more broadly cast, and for purposes of this conversation, we broadly cast it because public health infrastructure, and I'll tie this to MAHA in a minute, public health infrastructure is CMS, Medicare, Medicaid, Titles 19, 20, and you name it. That's the infrastructure, broadly speaking, but that infrastructure is there for the acute healthcare system. The overfunded, excessively hierarchical and over-engineered sick care system, aka acute care, okay? That's typically what's implicated in the broader brush. I saw something that came to me in a email from MAHA, and it basically made the argument that the people to blame are the bureaucrats in the public health infrastructure. And I go, okay, depends on which infrastructure you may be referring to. Okay, so it's the bastard child of the acute care health system. Yes, enough is enough. Fred, unbundle it for us.
Yeah, so I kind of looked at it from a couple of different points of view. One was the healthcare system, and the idea of moving upstream is good, trying to keep people healthier. And I would broaden what you're thinking about in terms of, as you mentioned, the public health departments and CMS with Medicare, Medicaid, and those services in healthcare. But it's also about the rest of the social determinants of health. It's about housing. It's about clean water. It's about all of those things that impact an individual's life and ultimately lead to these health risks and health outcomes. And we're seeing this just decimation of that stuff. We're seeing this unwillingness to fund, or let's pull all of these funds out that are directly impacting people's lives, the research, et cetera. The idea of cutting these NIH funds around research is just bonkers. This country has been amazingly great and built upon the power of research, of funding research, of the discoveries made through that research. And we also see this whole social media approach that just allows the blasting of information that is not true, that in essence doesn't have any relevant science behind it. It's just bogus stuff. And I think what happened to me is I just finally said, I've had enough. It's time to just begin to speak out and put my voice out in that community too, to say, wait a second, let's deal with reality. And that's why, this post is people, health, research, and reality. It is about people's lives. We do have individuals who need help. We have some individuals that will need help for their entire life. Others may need help for certain periods, and we need to figure out how to do that. Then they, look at things non-scientifically. Well, let's get real. Science is an iterative process. We don't know all the answers, and that actually is how this thing works, because it leads people to say, we don't know that. Let's go do some research in that and discover what's new. We may discover that we had originally wasn't quite correct or was wrong, or we may discover that, hey, we can build on that and then do more. And I think people don't understand the power of science as well as how it works. And that's something I think we also need to address. So there are a lot of issues that sort of come to the fore with what we've seen coming out of Washington over the past year and a half or so.
Gotcha. So care to speculate as to the why so many people are misinformed, general public, and even those of us who are closer to the science world? There's still a fair amount of misunderstanding, but science is an iterative process. Talk more about why do you think the public's so ill-informed?
I think one, education. It is about understanding what the scientific process is, learning about that in school, et cetera, understanding its strengths as well as its weaknesses and how it looks at things statistically, et cetera. I think statistics are tough. I also think loud voices are being heard. People have short attention spans because of what we've seen through the power of all the social media. I heard an interesting statistic from a film school, and given that one of my sons involved in film and TV, and they said the younger kids in film school now are having a tough time sitting through an entire film because their attention spans have been dropped so much. And so those little blurbs, those short comments that somebody says, hey, we have this product and this product is going to fix your problem.
Right.
And there may be no true data behind that. And that's another thing. If you're going to make a statement, show the data. Where is it? Has the study been done? And has the study been done correctly? Is it inferring that? Does it actually show that? And those kinds of things, I think, require a little bit deeper understanding that sometimes we just haven't taught people.
Absolutely. And this sense of looking smart, sounding good, and having quick and answers to every question, somehow that seems to be the currency, when in fact, underneath that, there's very little that supports it. So science is, yes, it's iterative, but it's also a way of moving from unreasonable certainty to reasonable uncertainty. There are many people out there who make these declarations with total confidence. You cannot, that they can penetrate in any way, shape, or form their confidence that they speak the truth with a capital T. But the truth is, it reveals itself a bit at a time. It is iterative, more data, more conclusion, more validation. So you move from this, absolute certainty to reasonable uncertainty. And in the reasonable uncertainty, you then test your hypotheses to develop more confidence, right?
And actually, as you talk about reasonable and confidence, it is all about what is the statistical likelihood supporting that information, what supports it,
right?
And so knowing with certainty is very rare in a sense. We know with some statistical confidence that this is what happens, that this occurs. And I think about the iterative process, and one of the best ones that you'll ever see is the 40 years of HIV and AIDS. And what was learned early on, about it, the disease, and then ultimately having one product that seemed to do so, that did something. And then, triple combo therapy. Now we can begin to do that. We understand what viral load is and T cell count, et cetera. And now over that time period, we've moved to PrEP, where you can get pre-exposure prophylaxis and take a drug that will reduce your risk of getting the disease. Is it 100%? No. but it's
Yeah.
very, very high.
Right.
And ultimately what we want to do is find the solution, the product to solve that, to get rid of the disease. And I think we've seen a couple cases with some stem cell treatment. But early on again, so you have to study these things. So I was thinking about how that process went and how much went into all of the different diseases we treat today and understand, whether it's diabetes or asthma or heart failure, and where we are early with things like Alzheimer's, but are beginning to make progress. That's the scientific process around health. And just coming out and saying, go take this supplement and it's going to solve all your stuff. Where's the data? If you're going to make a statement, show us the data. And I think that's where we need to get to, but it's so much easier to make the statement than it is to do the study.
Right. Because we reversed our priorities, and in essence, because of this valuing of people who make bold statements, declare things to be so, with or without data, that has enabled the return of health quackery. Because there's always been a fair share in the supplement world, in the health and wellness space. There's all sorts of claims that go way beyond any efficacy or proven, like double-blind studies that prove efficacy. But we're seeing a lot of quackery, and the decimation of the public health infrastructure really began to take flight when Musk and his bros at Doge descended upon various agencies, including Social Security, CMS, all over the place. But the worst offense was the decimation, the defunding, total destruction of USAID. USAID had an amazing benefit globally in terms of public health, disease surveillance and monitoring and control. And defunding that effort has resulted in just a few things that maybe you can speak to.
Yeah, no, I think we recognize now around the world that we're interconnected now, whether it's flights, if someone comes across on a cruise or a boat, and so it's no longer a separate world. And many of these things that we see that USAID worked on, both to help the country and the individuals living there, as well as to maintain this surveillance of what's going on that might end up in the United States and, through a flight or something like the current Ebola outbreak, or we think about, COVID first showing up. Things like that, I think, are critical to understand that as we get rid of that infrastructure to monitor those things, to help those individuals, then we create an opportunity for it to be worse here. And at the same time, we're cutting the funding here. We're cutting the research funding, and this idea of studying this stuff, you never know what's going to come out of some research project, and then it may lead to another great discovery. We've made amazing advances in the United States by funding research into basic research, as well as more developed research around individuals and their diseases and things like that. And by unfunding this stuff or defunding it, we're just hurting ourselves. And we're also hurting our ability to lead. If we're going to be great, you have to lead. If you don't have this new stuff, if you're not doing this research, either somebody else will or nobody will. And then we won't be able to solve these problems that we face. And at the same time, I get back to this idea that individuals in this country need help. And you defund a lot of things that ultimately lead to worse health, whether that's worse physical or behavioral health because of the issues individuals face in their lives that we should be helping them with.
I kind of feel like I know the answer to this question, but I want to
Sure.
pose it anyway. What's your take on why so many dubious health claims can spread much faster than evidence-based medicine? And is it a function of social media?
I think social media and education. And so, yeah, obviously social media is incredibly powerful now. You can see how individuals I happen to be listening to one of the individuals, my sons, when we were driving around a couple of weeks ago, and I'd never listened to this person, and their claims were completely crazy, but they have millions of listeners. And I was laughing and telling my guys, why do you listen to this stuff? They said, because we find it funny. No, we don't believe any of it, but it's funny. But a lot of people do believe it. I talk to individuals who watch or listen to that stuff, and they get it. And I think what we have to do now, which has been a little more difficult, is speak out.
Yeah.
We have to, because if we don't, if we just let it rip, it's going to overflow the system. It's going to
Well,
dive.
what duty do you think health professionals have to maybe challenge some of these false claims and speak up, if you will?
Well, and that's where it gets really interesting, because one of the classic examples this past week or so was the whole ADA meeting, where individuals who were in the ADA were at their meeting, and there was a speaker coming in, and they were concerned about the NIH cuts and some of the other cuts to funding. And they actually had brought the editorial that they had written that was in the ADA journal, accepted for publication in the journal, and they were handing it out and got escorted out by police from their own
Wow.
conference.
Really?
Yes. And so you
Yeah.
think about that and you say, wait a second. I mean, how many conferences have you been to, Greg, where on the tables they've got their journals? You know,
Yeah.
they're handing them out. Grab a copy. Well, this was an article in one of their journals, and they kicked them out. And I understand there have now been some individuals who have resigned from the ADA because of this. It really is a stunning statement that this has gotten so overrun politically that they couldn't hand that out.
Just tuning in? You're listening to Pop Health Week on Healthcare Now Radio with host Fred Goldstein, president of Accountable Health LLC. Stay tuned for the rest of the story.
Well, there's definitely a chill. I'm kind of at the stage in my life where I don't care anymore. I just don't care. And so I'm willing to risk, whether it's Twitter or blog posts or radio shows or podcasts. I think that we have been grossly underserved and misserved by decades of so-called health innovation. We put lipstick on a pig, and in most cases, it's the same one in a new bottle with a different label.
Yeah.
So I've tracked this from the evolution of managed healthcare, HMOs in particular, then the IPA spinoffs to go into mainstream medicine and build out from there. And then PPOs came up because they were a little less controlling than HMOs. They're a little more palatable to that large group health market who didn't want to stuff people in narrow networks or closed loop HMOs. So we've gone that tracked through that from HMOs then to, now ACOs and value care, healthcare organizations and managed care organizations. They're all out there. They haven't solved the problem. They've just created more hurdles and obstacles for people to jump through to get needed care. No one likes it. Meanwhile, costs are still accelerating through the stratosphere. Access is spotty, and quality is a crapshoot. After all this innovation, including the benefits from tech and more agile business models, whether it's that whole section of the world that peels off into concierge medicine or direct practice, or retainer medicine, who get out of the billing and collections mindset. Even that pool, has been innovating, but I haven't seen any systemic relief. So yeah, I'm a little more bold these days, and so I will continue. For what it's worth, I'm a nobody, but
Yeah.
me too. Yeah, well, but I am trained in public health, and you have a very appropriate academic and lived experience, professional track record out there managing these complex institutions. So we do have a bit of a perspective, but as far as that goes, anyway, so.
And so let me add one thing. I sort of separated out the healthcare system from this idea of defunding research and, helping individuals out and things. The healthcare system, as I said, it's essentially broken. And, we've got this whole deal that I don't know that we can fix that. And I actually said, yes, our healthcare system is screwed up, but don't slam research funding because of the outcomes. Fix the system.
Right.
This concept they do have of trying to move upstream and keep people healthier is a good idea. But I did say, then again, 40 years later, and sadly, it's still good luck with that. The system is embedded. It is so solid concrete that you may chip a little piece off of it, but it ain't going to change. And we've got to recognize that and and begin to look at other things to help individuals and to improve the health of this country. As I mentioned too, I was interviewing somebody from my class this morning, and essentially they've been studying ACOs and value-based care and everything at a very high level and looking at it. And he said, look, the reality is, yeah, it might have been a 4% trend and it bent it to 3.5. It's never going to drop costs because the system will not let it. And the system has a lot of control and power. But in terms of some of these things, we need to speak up. And I think people are beginning to, because they're recognizing it's now damaging. It's not just about trying to control costs or see if we can come up with a better system. It's just damaging some of these things. And that's just not appropriate. That's not what this country's about.
Yeah, I just think that the investment in creating a physician, and how many of them are just burning out and exiting the system, whether it's entrepreneurial calling or admin roles or CMIOs or something that's just not direct clinical care. What a waste, I mean, 4 years of medical school, 4+ years of residency, and if some do fellowships, and by the time they're out there loose on the world, they've been in school for 12, 13 years. I mean, it's postgraduate. So,
right. And have a gigantic bill to repay.
Yeah, absolutely. So, another reason, because of that bill, the debt to get there, that no one goes into primary care because it's just disproportionately financially appealing.
Right. And when you think about it, as we've discussed many times from a perspective of health in the country, if we want to improve the health of this country, the individuals living here, if we want to better champion public health, what do we need more of? Primary care.
Right.
We need better access, individuals getting to primary care physicians who can make a difference and help that individual achieve a healthier life, along with funding all of those other things that are outside the purview of a doctor. Housing, safe communities, parks, water, education. Mm-hmm. Those are critical. And we just seem to be, at this period of time in the country's operations, just wiping those out.
Absolutely. And as you've mentioned, research is a national strategic asset, and chopping there is just the wrong place to focus on. So let's talk a little bit about this whole idea of prevention versus treatment. You mentioned one of the reasons that it's so difficult to transform this legacy healthcare delivery and financing ecosystem we've inherited. We collectively have co-created it, but it's ours, okay, yeah. and we own it, and it's just not working the way we had hoped. It's perhaps working as designed, but it's not the endpoints that we had hoped for, which is improved health outcomes, up-leveled public and population health indices. So what can we say about this prevention versus treatment angle? Because where I want to say is our colleague and friend, Gil Bash, he just published a book, Healing the Healthcare System and Why It Matters. And he basically says that the healthcare system views itself as the client, not us, the patients. It's focused on its own internal dynamics and sustainability, and it has not tepid, but it has somewhat of a tenuous relationship with the primary market we believe it's here to serve, which is patients, us.
Mm-hmm. Well, I mean, I agree with that, except I would take one group and potentially exclude them from that problem, and that's the physicians. Yes, some physicians go into it as a money-making endeavor, and that's why we do see the move into specialty care versus into primary care. But I think many individuals who are physicians, the majority for sure, are in it for a reason to help. They do want to do the right thing, but the system doesn't allow for it. Yeah. If you create health today, if you are a primary care doctor, unless you are globally capitated, if you created a healthy population, right, you're going to make no money.
Yeah, exactly.
So you can't do that. And then when you're acquired by a hospital or a VC firm or something else, they ain't going to let you do that. Right. Hey, I need that person admitted.
And by the way, you actually implied it, or you said it, but I'll reemphasize it. Really, there's no prevention business model. As long as you're on a fee-for-service system,
And when you have an 85% medical loss ratio in the product. Right. So you go in and create a healthy population.
Right.
What good is that? You're going to get 15% of a smaller number.
Yeah.
So nobody really does that. They want to run it right up to that, maybe get a little higher for next year. Right. So I can get 15% of a bigger number.
Yes,
and I think that's a problem that, as I've discussed with some of the folks who work in Congress, they ain't going to fix that, because you don't want the health plan to come in and say, I know how to make money.
Right.
Just don't give you any care, which is a problem in and of itself. And that's why we see all the prior authorization crap and the rest of it.
Exactly. Well, we all know, you and I know, which model probably makes more sense, but I don't see us getting there anytime soon. So in the final minute we have here, give me a summary of the message you want to leave our audience.
Well, I would hope that everybody out there who understands this and takes a look at it and potentially agrees with us begins to speak up. We need our voices heard. We need individuals to get involved, because people are hurting. They're going to hurt worse. And it's not what we're about. So I would hope that individuals will begin. I know it's a tough one. Stick your head above the table and get it taken off. But I think we're beginning to see more and more people do that. And the more we get, the more we can move stuff in the right direction.
There you go. Silence is acceptance, people. Speak up. I know I don't walk in your shoes necessarily, but I would encourage you to heed Fred's call to say something. We've got to. Anyway, Fred, thank you for a very quick 26 minutes on our show today. Thanks for sharing your thoughts and ideas.
And thanks for sharing yours too. It's important stuff. You've got a viewpoint and history and experience that means something.
And that's a wrap for today, folks. A big thank you to our global audience for tuning in. If PopHealth Week resonates with you, show us some love. Give us a thumbs up on your favorite podcast platform. Share it with your network, and do subscribe so you never miss a future episode. Remember, we're live on Healthcare Now Radio every weekday at 5:30 a.m., 1:30 p.m., and 9:30 p.m. Eastern. That's 2:30 a.m., 10:30 a.m., and 6:30 p.m. Pacific. On behalf of Fred Goldstein, myself, and the crew at Healthcare Now Radio, stay safe, stay tuned, and we'll catch you next time.